So in this study, we basically assessed cardiovascular mortality in patients, adult patients diagnosed with leukemia. So for this project, we obtained data from surveillance epidemiology and end results database, also known as SEER database. So it's a very large database which collects information on cancer statistics in patients in the United States, and it covers approximately 27% of the US population. So our main outcome of interest in this study was standardized mortality ratio, which is calculated as the number of expected deaths divided by number of observed deaths divided by the number of expected deaths in the age-matched US population. And our results has indicated that the cardiovascular mortality, the risk of cardiovascular mortality was highest within 2 years of initial diagnosis. So we assessed cardiovascular mortality at different latency period after the initial diagnosis. For example, first latency period was within 2 years of diagnosis, 2 to 5 years of diagnosis, and more than 5 years of diagnosis. So we have found that the risk of cardiovascular mortality was highest within 2 years of initial diagnosis. So this was the result in the overall population, and then we stratified the results based on different subgroups of interest. For example, there was one subgroup based on age. So we have found that the risk of cardiovascular mortality was highest in younger adults who were less than 50 years of age. And similarly, there was a subgroup for race and ethnicity as well. And regarding race, we have found that the risk of cardiovascular mortality was highest in Asians, followed by blacks and white population. Similarly, for ethnicity, we have found that the Hispanics had the greater risk of cardiovascular mortality as compared to the non-Hispanics. And there was another subgroup based on the treatment, and we assessed cardiovascular mortality in patients who received chemotherapy versus who did not receive chemotherapy for leukemias. And we have found that the patients who received chemotherapy, they had the higher risk of cardiovascular mortality as compared to the patients who did not receive chemotherapy.